Good morning, everyone. So, a bit different session. So, the era of the new century about the AI. So, we'll be speaking about AI ideas in orthopedics. It's a whole team of speakers. Everyone will be presenting an idea, and I think a lot of them are very relevant to the practice in Egypt and will be very useful. We promise you of a different session. So we have 7 topics, all about AI and applications in orthopedics. The first one will be presented by Mr. Tamir Kamal from East Kent University Hospitals in UK, and he will be presenting about an AI-assisted learning model, which we call OrthoXcel Study Buddy. Mr. Kamal, please.
Thank you, Mr. Chairman. Good morning, everyone. My name is Tamir Kamal. I'm one of the OrthoXcel group, and this is a group that's very interested in teaching, education, and training based in the UK. So we talk about AI-assisted learning in orthopedics, and when you're going for a big exam like the FRCS or your MD degree, or you think about the American board, European boards, you're faced with lots of challenges. There's lots of stress, unclear marking. You don't know if you have enough time to do your practice. You have to work full time at the same time, and at the same time you have to support your family. You have limited time to practice, limited resources, okay, and you need to juggle all of this and include it in your training. And if you don't prepare well, that's what I expect. You're not going to pass the exam. You've got lots of stresses, lots of causes for this. One, lots of data to cover. This is a life-changing exam. Okay, you might have weakness in your training and your education that you're not aware of. You don't know the system, but this is one main problem. And this is one of lots of things that people will face if going for an international exam. What is expected from you? What is, do you need to do to achieve the pass mark? The cost of courses, it can accumulate to about £7,000 to £12,000 in the UK if you're going for FRCS course. They're very expensive, ranging between minimum is 500 to 750 to £1,500 on certain courses. Now, if you look at the bigger problem, okay, medical training have evolved. I'm not biased at all, but as you can see, everything started in Egypt, okay? So we have what we call the Per-Ankh, and Per-Ankh is a group that's 3,000 years. They have a focused teaching and studying, training doctors and priests on medical studies. Got lots of evolution that carries through. So the Islamic era was a big renaissance for medical education. Now, early 1900, modern standardization and what we're going through. Then we came to year 2000, and the age of computers, visual learning, e-learning, but now we're moving to AI. And what can AI help us? So we identify the gap, okay? There's no adaptive system that will tell you about what is expected from you. All the different exams require different structure, different scoring, different curriculum. So if you're moving from one place to another, it becomes a big challenge. The cost we highlighted before is very expensive. And when it comes in, we speak to the patient, someone who failed his exam, he doesn't understand why I said I did everything. But he doesn't have any real insight of what he did wrong, because there's no proper feedback that comes from the examiners or from his training. So this is where we came with the study buddy idea. So this is an AI tutor for orthopedics. And what you need to pass an exam is, a very essential exam, is mainly 4 items. 1, you need to get the knowledge. 2, you need to be familiar with the exam. 3, you have to get the experience. And 4, mainly, you need to understand what is expected from you for the exam, what's the examiner expecting from you to give you the pass mark. And that's what we try to include in the AI model. So what we've included is about 800 till now examiner verified Viva questions. We're taking the FRCS course as a model for the time being. Okay? We managed to give him and feed him lots of textbooks, guidelines, and papers. So this is his base knowledge that he's going to be going and getting the information from. We uploaded all the syllabus, so now he knows what is expected on the curriculum. So the stuff is not in the curriculum, he's not going to focus on when he's trying to train you. Okay? Now, every exam we talk have a marking system, and the FRCS have a very strict marking system. And that's mainly, it goes, how you shake hands, how you introduce yourself, how you start with the patient, how you deal with the patient, all of this is marked. What is expected from you to get a 6, which is a pass mark, a 7, which is a good pass, an 8, or, God forbid, you get a 4 or 5, which is a fail. Okay? We included senior examiner's commentary, so now we have the experience from previous examiners and previous tutors. And we want the AI to be able to talk to you, because in the Viva or clinical, you have to talk. We are surgeons. When we're operating, we don't talk a lot. We're just doing our stuff and we focus on it. You sit down and study it, okay? But when you're trying to express your emotions and your feelings and your knowledge, you have to stick to a certain time and you have to do it properly. And sometimes it's not your first language. And that's an issue and a problem that you face. So how it works? First, you'll select the topic you're revising. The AI will generate a scenario for you. Okay, you will answer either by voice or text. The AI will score you like an examiner. Now he's got the knowledge how to score you and the experience. And then he will give you feedback. So this is from my point of view. He will tell you, this is my point of view. You get a 5 or a 6. Now let's work on improving it. We'll give you, move from a 6 to a 7. How we move from a 5 to a 6. Okay, and it will track your progress through time. So now we know your weakness and your strengths when you're studying. So when you open the this is a web page service. So you open it, it will offer you a practice mode or exam mode. For practice, there's no time limit. Okay, you take your time. It's more, as you can see here, you have a scenario, you type it or you speak it. This is a feature that I like more. And you submit it for analysis. But if you go to the exam model, everything is against time. You have to answer the exam for FRCS within 5 minutes. Every word after this 5 minutes does not count. It's move on. You're going to be getting in every station, biomechanics or 6 questions, 5 minutes each. You talking extra doesn't count. The examiners are told not to count any of this information. So you have to stick to the time. Okay? So this is an AI trained like an examiner. It has clinical judgment from the experience of surgeon and examiners. It will highlight the red flags for you, because if you talk about Corda equina case, for example, and you didn't mention bladder scan or clinical examination or highlight some important features, these are red flags. This is an immediate fail. So he will tell you, you need to do this. These are very important. It will help you structure your answer, because you could be waffling about one item, forgetting another 4. Okay? And assess your communication. Because now you can hear yourself talking. Did I actually say this? So in my practice for my exam, I used to walk around with the dictaphone and listening to myself. I said, what did I say? This is not acceptable. I need to improve on that. And if you compare it to author bullets versus study buddy, so this is a version that can be personalized to any exam. It's very adaptive. All we need to do is include the new curriculum and some expertise from the examiners and the marking scheme. And now we apply it for the Egyptian board, the Arab board. Okay? It's very adaptive and very interactive. And it saves you time. You practice with yourself whenever you're free, on the phone, on the app. And it puts you where the examiner wants you to be. The vision is we try to make this more adaptive for training and most cost-effective for everyone. Okay? We'll never replace the trainers, but if a trainees use AI, he'll perform better than others.
Great work, a good answer.
Okay,
you mentioned several important key factors.
I would like it to be, but
this should score you a 6. Now let's aim for an 8.
So we tell you, this is your scoring 6, but I want you to get an 8. And to get an 8, you need to mention this, this, and this. Thank you.
Thank you, Dr. Tamer, for this talk. I think we'll need a very long discussion for this session. May I call for the next speaker, Dr. Mohammed Hashim from UK. He will talk about digital transformation in arthroplasty, intelligent Egyptian joint registry.
Thanks, Mr. Chairman. This is me again, and good morning, everyone. And this is it's close to my heart to speak about this. I think having an Egyptian joint registry is a dream for a long time. I know about a lot of trials to do that, which has faced a lot of logistics problem. And I think this is a time for the AI to solve these problems and to use the AI in a different, like regenerative way rather than just searching or asking questions. Again, my name is Mohammed Hashim. I'm Egyptian, UK-based consultant. So when we speak about digital transformation, arthroplasty, there is no question that we are in the era of the AI. Technology and smart tools should be used to reshape how we plan, how we operate, and how we care about every joint replacement operation. So the idea was to make an Egyptian AI-powered joint registry, make it an intelligent registry which doesn't need any logistics. It's just a web app or a mobile app which you can put all your data on. And this AI model will be able to analyze this, give you an outcomes, and help you to monitor and improve your practice. So the goal was very simple, is safer care, better outcomes, smarter decision powered by the real data. So I will go through this presentation in a roadmap. So starting to speak about the idea of registry and how this is important for every arthroplasty practice. Then I will speak about the learning we got from the global pioneers in this. There is 4 successful joint registry all over the world, and there is another trials. And one will be a surprise if you know that even the United States of America, they try to have a full joint registry, but till the moment they have just data collection, they don't have a full registry. Then I will show you how we progressed, how we make a framework for the Egyptian joint registry, the smart Egyptian joint registry by AI, and lastly, we'll show what we shall go in the next steps and how will be the challenges facing us in applying this. So there is no question about the importance of registry. You can operate, you may be the best surgeon, but if you don't know about your results, you're missing a big step. So it's very vital to track your operations and track the implant. It's very important to an association like an all association like the Egyptian Orthopaedic Association to monitor the surgeon, know how the surgery is going, to look into every implant. It's important for the surgeon to follow up his outcomes and ensure that he is heading the right way. And it's very important for the industry to know about the implant and what implants are doing well, what are not doing well, and what we shall continue using, what we shall not continue using. It's very important in early detection of problems. So we all know that for example, the total hip replacement by various different stages, a lot of implant has completely demolished from the market after a few years because basically the National Joint Registry in UK has, say, a lot of failures from this implant, and immediately they abandon it. They will never be able to do that unless they have a very robust joint registry. Definitely, it's very important to protect the patient and the surgeon. So if I'm using a well-known implant with good registry data, I'm safe medically legally if the patient says, oh no, this implant has failed. Yeah, it's failed as a rating complication. It's not a fail because the implant is not good. I have a registry data to support this. I've used this approach because this approach is known to give a good results in the registry data. So without the registry data, you don't have this evidence in hand, and you are exposed to a lot of medical legal problems. So it's protecting the surgeon, and on the other side, it attracts a lot of public confidence. So patient has an access to the National Joint Registry, and if they see that this joint registry says posterior approach using like an extra hip, so the patient will have more confidence in the operation, and this will reduce a lot of the medical legal issues and conflicts. So the current challenges in arthroplasty is raising implant demand, hundreds and hundreds of implants in the market. Now we need an implant with very long lifespan because our patients are aging, the patient aging is going more and more, and we need the implant to live more and more. The implant don't last forever, so we need to try to find the best implant, which is a very difficult task. There's a lot of increasing complication, and unfortunately, there is lack of data, which creates a lot of blind spots in the arthroplasty practice. So what about the global models of joint registry? We don't create the wall at this stage. We just reuse it. So a lot to learn from the global pioneers, understand the importance of registry, and adopting a successful model to follow them. So the most successful, without any bias, is the National Joint Registry in UK. Is the oldest, and it started with a very simple idea, collecting data locally, and this put this data to a national board, which is the national board collecting this, analyzing and sending reports to the hospitals and the surgeons. As you can see, it has access to the surgeon, to the patient, to the healthcare providers, to researchers, to implant suppliers, and to stakeholders. Australian Joint Registry, again, have a very good and robust data, have a very good analysis, early outcomes, and early alarming to the patient and hospitals. Same for the Swedish Joint Registry with an advantage or privilege of a more simpler data input. Then, as you see, there is a lot of trials in Germany and US to start having a full, well-formed joint registry. So the message coming to say that data equals safety. So from the data, you can say, yes, this approach is safe, this implant is safe. Data equals quality. So you can, yes, this is the best implant I can use, this is the best approach I can use based on the joint registry. Data equals power, because simply, if you have an access to reliable data, this empowers the healthcare system completely, either the end user or the surgeon, and definitely strong system empowers registries. So what was the idea when we come to do an Egyptian joint registry or to suggest an Egyptian joint registry? We have a minimum setup. We need to use the resources we have. We have to have a surgeon-friendly interface, try to find a barcode for scanning to get more accurate data collection, and we have to make this as a mobile and web app. So this is the picture from the app. This app is already there. The point is we haven't expanded yet. I think we need the support of the British Orthopaedic Association to do this as the largest specialty society body. As you can see, we make the model, the front end, using hip, knee, and shoulder data only as the most commonly used in Egypt. And as you can see, basically, it gives you, as a surgeon, number of operations you've done, how many these months, what about the side, what implant did you use, what's about the approach, all the data you need to know. This is the front page of how to put a selection for a patient. So very simply, you create a new patient, you can put an identifier for the patient, you just put the operation date, side, the type of procedure, the indication, the approach, the type of implant, the type of fixation, the type of bearing, and then you add all the operation details, and then finally you put the surgical team. If you want to do any component tracking, you can do this for a different components, and you can add any notes you want to add. Then this is how the analytics come. So the analytics for you is a different page from analytics for a hospital, is a different page from analytics for the Egyptian Orthopaedic Society, for example, or for the decision maker. So you can see number of operations happen in Egypt, the number of these months, the success rate, the components recalls or problems, and you can spot easily any problem coming. If we go, make it, yeah. Okay, so governance-wise, it's very secured. Everything is encrypted. There is no single frank data there, so there is no problem with the encryptation and data security. It needs a lot of collaboration between the hospitals. It needs engagement from the surgeon. It needs a support definitely from IT teams. It's not a difficult one, so the basic structure is very simple. All you need is just maintenance, and it needs to have a defined role what everyone will do to get this registry successful. So piloting, if we want to apply this, it needs firstly support from the different associations in Egypt. There is the Egyptian Orthopaedic Association, there is the Association for Pelvic and Hip and Knee Surgery, there is an association for hip and for arthroplasty and arthroscopy. So we need to select firstly the tertiary hospitals, which is doing standard procedures. Then we'll start asking them to put the data, make a data entry, we scan the data. We're waiting to see a lot of challenges and issues which we need to fix after piloting. Really challenge which we'll see is definitely changing the mindset, which is not simple. Engaging the private sector will not be easy, and training teams effectively, that's not very difficult, and securing long-term funding, and I think we have the option to do that. So, rolling ahead, I think Egyptian Orthopaedic Association, I'm planning to just put this to the board to have a discussion about it, get engagement from all the stakeholders to speak about this and see if we can apply it or not. Then start with this piloting and then a framework to apply it even in a short cohort, then in a long cohort, then to become a national thing. So basically, it's an idea and a dream, and hopefully we will be able to apply it We already based the model, we trained it on a neurology problem to record the stents, and it's very applicable for arthroplasty. All what is needed is a higher management support, and I think Egyptian Orthopaedic Association will be our supporter in this. Thank you so much.
Next speaker, Dr. Muhammad Al-Kammal, will speak about transforming learning through augmented intelligence.
Morning, everyone. I'm really honored to be here now. I can't locate many non-Arabic speakers, so most of my talk will be in Arabic, if that's okay. So, over the last few years, the AI has growing rapidly, and we are trying to get the most benefit of it, trying to make ourselves more accurate, faster, and try to help ourselves. Using the AI is not a crisis itself. It just will help you not to fall behind, not to be left behind, and it will help you to improve yourself. So we use AI in orthopedic education in many ways, and I will go through each one of it. So what about the current challenges in orthopedic education we face? أول حاجة explosive knowledge. There is a lot of information that you need to take. There's a lot of classification, especially in orthopedic. You need to memorize complex trauma algorithm, especially in the UK. Everything has a pathway, everything has an algorithm. So you need to remember every single step of the algorithm, which is not easy. Additionally, competence-based frameworks. في UK في نظام احنا بنتدرب بيه اللي هو كل حاجة لازم تفل الكومبتنسي بتاعتها، فانت لازم تمت كرايتيريا معينة عشان تتنقل من ليفل 1 في التريننج ليفل 2 ليفل 3 ليفل 4 لحد ما توصل ان انت تبقى كونسلتنت. كمان الليميتد تيتشنج تايم، وده اعتقد ان هو موجود اكتر في مصر. مفيش ستراكشر تيتشنج تايم لاي حد في الزمالة، اعتقد الماستر موجود فيه. So we have the human surgeon. We have to enhance his capabilities through many pathways that we can do. أنا هغطي كمان شوية مستر كمال ومستر هاشم اتكلموا عنهم، هجو ديب في specific examples. large language modules. دلوقتي ال AI اتطور لدرجة إن أنا ممكن أخوض حوار متكافئ معاه، ومش بس ممكن يسيميوليت الإكزامينر، لا هو ممكن كمان يسيميوليت إن هو patient وياخد معاه خطوة بخطوة. فده بالذات مهم جدا في الاكزامز بتاعت الاوسكي والفايفا. فهو دلوقتي الاي اي they built their abilities to be a Socratic educator. They can ask you frequent questions. Every question follows the other question in a logic manner. They can go deep. They can be so superficial, and they can ask you about things you will never think about. كمان في ال FRCS ناس كتير بدأت إن هم يستخدموا ال AI to generate a question bank for training. وده كان يعني نقلة نوعية في ال AI الفترة الأخيرة كمان. الحاجة المهمة كمان إن مش بس ال AI ممكن يسألك في حاجات already موجودة، لا هو easy. They can generate content for you to study, and they do flashcards, which I will explore in the next slide. So, first of all, any surgery, to do any kind of surgery, you need to have the knowledge to do your training, and then you will operate, and then you will repeat the cycle again. ما أعتقدش إن ده إن إحنا نعمل surgery على عيان without having the knowledge or without having the training. ده شيء صح أو ده شيء حلال أساساً. So, هناخد كل خطوة في steps of surgery وازاي ممكن ال AI يفيدنا فيها. اول حاجه في البارت بتاع النوليدج، من الامثله اللي انا حابب اتكلم عنها جوجل نوت بوك LM. ده اب ممكن ان انت تابلود سورسز معينه عليه، اي كتاب انت حابب تقراه، وبعد كده بتبدا تساله اسئله، هو بيكود الانسرز بتاعت الاسئله دي من السورسز بتاعتك، وبيبدا يعملها لك في شكل موضوع. مش بس كده، هو كمان ممكن ان هو يعمل لك ان الانسر دي على شكل فويس اوفر فيو، فانت كمان ممكن تسمعه، وخصوصا الوقت ضيق جدا، الناس مشغوله، فده ممكن تسمعه في عربيه في اي وقت. ده المثال. انا يمكن سالته الفرق بين السيمنتد and unscemented total hip replacement. I have uploaded already the books that I usually read, concise orthopedics, Miller review, and you can see the options on the right side of the screen. They can do an audio overview, video overview, they can even generate a flashcard, and recently they updated it, they can create PowerPoint slides also. If I just go back to the link, I'm not sure if it will work. Sorry, the link is not working. But when I asked them about the difference between cemented and uncemented total hip replacement, they gave me an answer and they classified our answer to steps. First thing, what is the indication? What is the type of fixation in each surgery? What kind of implant? What is the advantage? What is the disadvantage? And finally, what is the rate of revision in each one? And it was a very concise answer. I think it's very good for, especially for juniors, to start with this knowledge. And after 2 or 3 years of building your knowledge, you will not need that, but you will know what exactly you are reading for, so it will become easier to go for what you need. حاجة كمان ان انا شخصيا جربتها after reading about one topic which is mid-shaft clavicle fractures. في بيبرز كتير وفي بروتوكولز كتير للتعامل معاها، بس انا كل مرة ما كنتش بفتكر ايوه انا المفروض اعمل ايه. بيبرز كتير وايفيدنس كتير، ايوه الخطوة اللي جاية ايه. So after reading a lot of things and uploading all what I read to ChatGPT, and I asked him to create me an algorithm based on the information I already know and the information I've already read, just to make sure there is no mistake in the process. I've read this information, I know what's right, I know what's wrong, I just need some help with organization. So I asked him, what kind of algorithm based on something like FRCS algorithm? So step 1 was, I should assess displacement, comminution, smoking, and he even mentioned the absolute indication of open reduction internal fixation for the clavicle fractures on presentation. Okay, I've already passed that step. What is next? Next was, what is the early risk prediction for non-union? And he already quoted the papers that I've uploaded to him, just to make sure that everything is evidence-based. And finally, okay, what I will do for the patient in our clinic in follow-up after maybe 6 weeks. He already also quoted the paper and mentioned every single risk factor of the non-union and what should I do with each risk. I think it's gonna be very helpful for everyone using this in their life. If we can take this raw data furtherly in a different way, another AI project, Anki, which can make it more colorful, ممكن يعملها على شكل خريطة مايند ماب، وده هيبقى اسهل بكتير عشان بس نفتكر ويبقى الامور اسهل. بيعمل فلاش كاردز، ممكن تستخدم ده في انك تذاكر الماستر MD او ايفن ال FRCS. ممكن يسهل كتير من الكلاسيفيكيشن ويعمل لها سكيمز زي ما احنا متعودين. بعد كده الجزء بتاع التريننج دلوقتي فيه كتير من البروجكتس VR و AR سيرجيكال سيميوليشن. انت ممكن تعمل خطوه بخطوه العمليه من غير ما تكون في اوضه العمليات، بتمشي خطوه بخطوه من اول خطوه الانسيجن بتاعك، كل خطوه هتعملها ازاي وايه الانسترومنت اللي هتستخدمها، هتبقى فاميليار مع الانسترومنت، مش هنخش جوه اوضه العمليات ونبدا نسال الممرضه او السكراب نيرس ده اسمه ايه وات شود اي دو، انا عايز الآلة اللي بتعمل كذا. لا، ده هيسهلها، هيخليك more accurate and more familiar. اسف الوقت تايمز اوفر. ده البيبرز اللي انا بيزد عليها عملت البرزنتيشن دي. ده بيبين شات جي بي تي او الاي اي عموما عمل ايه في الامتحانات والاكيورسي بتاعته. Not everything is bright. Something on the other side. He failed the FRCS exam on this paper from 2023. Mainly, AI can help you to study faster, smarter, be more objective, and more accurate. And thank you.
Thank you, Dr. Muhammad Jamal, for nice talk. Next speaker, Islam Muhammad, will talk about implant book. Know your implant and plan smart before you start. Welcome.
Thank you. So my name is Islam Mohammed. I'm working at Trauma Orthopedic Registrar at Wexham Park Hospital. So I'm presenting this on behalf of OrthoXcel team. I'm presenting this idea or project about implant book, know your implant, plan smart before you start. So let me start with why we need that. All of us know that revision arthroplasty or trauma frequently involve implants that already sometimes more than 20 years old, or from companies that no longer exist, or simply off-shelf instrumentation. And for sure, for the surgeon, this is very annoying, keep wasting time searching among old catalogs, contacting different companies, or even try to look in the social media to get help. And even if you do identify the implant, the mismatch between the implant and extraction tools remains a very big challenge. All of this will increase the OR time, cost, risks, and make the surgical hard decision is very challenging and hard. So why this is a challenge? Every day, the implant designs are evolving dramatically. Old implants and early generations devices mostly will lack proper documentation with no universal database. And registries keeps telling us what was used, but it never tell us how it looks like. Social media groups, yeah, can be helpful, but remains unreliable, ungoverned, and very subjective. And for sure, the instrumentation availability varies among different hospitals or trusts. So our aim is to create an AI-driven implant registry and identification system. What will it do? So first of all, it will gather the data from the surgeons and manufacturer, recognizing the implants from X-ray or intraoperative photos, identify the manufacturer and generation, and suggests you what's the compatible extraction kits, and connecting you to the local data, what instruments in your hospital and what is not. And for sure, building a lifelong archive of discontinued systems. So in simple words, we are aiming for a universal AI model which is trained on implant images, registry data, and packaging labels to instantly identify orthopedic implant and guide its removal in an easy and governed way without starting with guessing. In simple words, how it works. So firstly, the surgeon will upload the X-ray or clinical photo. The platform will start analyzing the implant geometry and features. Then it will start searching for you and matches the implant with the database, and will come back for you with the output, which should include the name, manufacturer, generations, or the year range, removal tools required, and either if it's available in your hospital or you need to borrow it from somewhere. And not only that, it will show you the notes from tips and tricks from other surgeons for the similar cases done before. What will be the data sources? Can be joint registries, published implant catalogs, surgeries contributed by other surgeons worldwide, and all packaging labels, and online implant discussion communities and manufacturers' archives. So talking about example for how the homepage may look like, it will include the search bar where you can upload your X-ray or photo, and it will have some icons to specify what are you looking among, is it hip, knee, trauma or spines, and it will include option for urgent cases if you need to quick identification, and recent cases done in the same way. So let me show you how it may look like. So this may be the home page or the front page where you can find icon to just upload your X-ray. Even interoperatively, you'll find the icon for new case when you can get an image from the C-arm or clinical picture. Not only that, it will include the registry where you can browse among different implants to look if this implant is still actively in the marketing or discontinued or obsolete, and for sure your recent cases which you have done. So that's the output what we're aiming for. So it will show you the implant, what's the implant name, what's the manufacturer, if it's still active in market or not, and the removal set required, and if it's available or loan needed. Again, it will show you the whole details for the implant, and it also can show you some surgical techniques or some surgical tips and tricks from other surgeons worldwide that can be helpful. And for sure, you can search among the implant registry again to confirm is this implant or is active or not anymore. Definitely, there will be some challenges. We'll need to build up and collect a very strong database despite conflicting historical implant designs. Implant design should be validated, and data governance and general data protection regulation compliance are essential, especially when dealing with clinical photos. We need technical support and robust server to make sure that the platform is working reliably. So in summary, for sure, implant identification for revision surgery is a very big challenge, which is affecting safety, time, and outcomes. Currently, there is no universal solution available. I believe that surgeons with AI can create a dynamic, accurate implant registry with creating a platform that can identify, classify, and guide extraction. All of this will ultimately reduce the OR time, surgical stress, and bone loss, and make you start planning before operating. So as you can see, it's not a technology project. It's a surgical safety tool, which is built by the surgeons and will be for the surgeons to solve the problem we face every day. So I think, yeah, it's difficult, but it's doable to create the first living archive of arthroplasty and trauma implants, old or new, ensuring that there's no revision surgery start with just guessing work again. Thank you very much.
Thank you so much, Mr. Islam Muhammad, for your interesting talk. Before I am with the next speaker, Mr. Hashim, Mr. Muhammad Hashim, I would like to thank you so much for your support to be up to date with the hot topics in orthopedics. Mr. Hashim, you did a great job and a great support in this conference. I thank you so much, and also our dear colleagues from UK. This 77th conference of the Egyptian Orthopaedic Association, we are discussing the hot topics as we see up-to-date sessions. The first session, Artificial Intelligence in Orthopedic Surgery, organized and moderated by my dear brother, Mr. Hashim. And we have two sessions on Computerized Assisted Surgery, organized and moderated by our dear Chinese colleagues. And we did a live transmission for robotic knee surgery, organized and moderated by Sport Clinic Hellerson from Germany. So what I see now that many countries and many international guest speakers are gathered discussing hot topics under the big umbrella, the umbrella of the Egyptian Orthopaedic Association. Thank you so much, Mr. Hashim. Thank you.
Thanks, Mr. Chairman. Just two comments about the last two projects. So I think the first one, more of an interest to the juniors, using AI, especially the three tools which Muhammad has presented. The Notebook LM from Google is unpaid tool, and even the Pro from it, I think it costs £1,000 a year. And the Anki, which you give a flashcard, because you have the option now to search for a certain topic in a minute. So all the textbook, so the old days, if you want to study a topic, so you have the option either to go through the text box or to go through the up-to-date data with the new evidence and papers. And now Notebook LM from Google can do that for you. You just list all the sources, including videos, including voice notes, including everything you imagine on the web, but all the resources from textbooks, but all the resources from the papers, and he itself can do that for you. You can ask him to search for the last evidence about revision in periprosthetic fracture. We'll get you all the evidence. If you add this in the sources, it will create for you whatever you want. If you want a source to study from, it will give you. If you want a voice note, it will give you. If you want a conversation, like two are speaking to each other, giving you all this data, it will give you. The implant book, I think, is more needed in Egypt, but this is directed toward the seniors because there's no doubt that you stand in front of a case saying, oh, this implant needs to be revised, and I don't recognize this implant, especially a lot of generic implants in Egypt. We have the same problem everywhere, even in UK, there is genuine products, but still, you don't know what this implant, how it can be removed. Can I use, like, oh, this is like an old Shanley, can I use the new Exter to remove it or not? Well, what the challenge I will face inside? Do I need to do an ETO or not? So the implant book simply is a mobile app with everyone. All what you need when you face a picture for an implant which needs a revision, you just take the photo, put it to the app already uploaded by all the photos available in the market. There's a big society group on Instagram by Manoji Ramachandran, which is collecting all the old implants for revision. So I think it's a good database. And this mobile app for free. And all I do, I have this X-ray. You load your X-ray. It will tell you, yes, this implant is a Shanley implant. This can be removed. There is no instrumentation for it to remove it, but you can use this instrumentation from this company to remove it. And I think this will make your life much easier. Now I'm shifting the other way toward the private. So the Smart Clinic project is a project we initiated in Cleveland Clinic, London. The idea of the Smart Clinic was really directed to research more than clinical. So basically, the very experienced surgeon in the Cleveland Clinic, they don't have their data in hand. So if you want to look retrospectively, like in his arthroplasty operation, he doesn't have that in hand. So we try to move toward a smart clinic. So basically, without all this introduction, I will give you the idea in a simple way and how can it be used privately in Egypt, either in big private hospital or even private practices. So it's a microphone. On this microphone, once you start it, from the patient entrance, it will collect everything. You don't need to do anything. You speak to your patient, even in Arabic, and that's the beauty of the smart clinic, because the other, like the Titan, there is a lot of AI models doing this, but unfortunately, they are not trained on Arabic. So basically, we'll get a lot of shit in the informations. But this one is trained on Arabic, so you just start the microphone, your patient is in, but you need to verbalize everything. So, welcome, name, history, age, what's your problem? Now I'm examining the patient from the front, examining the patient from the side, examining the patient from the back. Then once you do that, and you finish the whole history and examination, the AI model will create full notes in the way you choose it. So if you need to do filing for all your patients, it will make a notes in the way of filing you like. And then if you need to request, it will request. So if you're working like Dar al-Fuad, or I'm not sure about the big hospitals doing this. If they have a back system or we have radiology system, it will send a request straight away to the radiology system. You don't need to do anything. Then if you want to like send a letter to a colleague, sending the patient for second opinion, sending a letter to a medical doctor who is doing optimization for the patient, it will do that for you. Then it will prepare a letter for the patient. If you want to give the patient a fit note, if you want to do something like that, it will do all of this for you. The good thing is, it is a web and mobile app, so you do all of this, you get a notification about your patient, the patient gets a notification about his appointment. It's an easy way to keep your patient with you, rather than missing the patient. They don't know that you are like in a conference or you're traveling or something like that. They get a notification that Dr. Muhammad is not here from this to this, and your appointment to see Dr. Muhammad will be next week. And it gives you a lot of alarms and notification. So next week you have list in Masan Dar es Salaam for 5 hips. This patient, this patient, this patient, this patient, and all what you need about them, all the details you need about them. The good thing, it has a finance part, so it will collect for you all the finance. You will be the only one accessing this, so you can know how many patients have you seen this month, in what different surgeries or clinics, how many did you collect from them, who still owe you some money, who is not, how many did you pay for the hospital, how many did you pay for the industry, everything. So the problem with this is the front picture of it, is making the clinic management. There they speak about the clinics. We speak here either about private clinics or even private hospitals. It gets you everything very smart in one place. My model can accommodate up to 750,000 patient data for free. So you don't need to pay any of this.
All what you get is a license from the technology product, so that there's a developer. It's a small team of Egyptian developers who developed it, and we trained it together. So all what you will get is a license for the product, but other than this, everything is free. So our problem is, we have a lot of booking overload, so you don't know, so your secretary is booking your patient to the clinic. You cannot control this. You have to call her to ask how many did you book today. But if you have this app, you will get a notification telling you your secretary has booked 5 patients for today in that clinic. Especially if you have multiple clinics, it's very easy to organize your way. You know from now by notification that there is no patient in that clinic. So like Masr Gedida clinic has no patient, but Helwan clinic has a lot of patients. So you know who is this, who is there, and you can manipulate them, move them from a site to site. Lost documents, which was the main aim of this, is to collect all your data, so you don't need to do anything. In a minute, you can get all your patients above 50 who had a total hip replacement by one click. And this was the main aim of it in the UK, which I've tried to transform it to the Egyptian practice. So is to get all your follow-ups in one place. And if you want to look 5 years back, you don't need to do anything, it's still one click. The problem if you don't file every patient, get images or clinical photos or x-rays photos for every patient, you will never be able to follow up your patients. This will get rid of everything. Your mobile will picture the photo, your mobile will picture the x-ray, and all of it go to the file of the patient, which you can recall at any time after 10 years, after 15 years. So if you want at any stage to stop and say, oh, I want to look back into my 15 years data, I was doing this hip at that time, and I want to see how is this patient doing. The app has all the patient details. The app can message the patient. The app can call the patient. So you can easily, if you want to, you have 15 patients done by this implant, you can call them and ensure how are they doing now. So you can, as you can see, our Indian colleagues has and Chinese colleague in the few sessions in the last 2 days, they shown data for 15 years. How do you get this data? It's so hard to do that. It's so hard to keep paperwork, it's so hard to keep X-ray films, it's so hard to keep even clinical photos for 15 years. Over the 15 years, you have moved your place 3-4 times, and these patients are already lost. The easy way to do that is to get everything on one server through an AI app. There is no defined patient pathway. Our patient is completely lost. Everything to deal with the patient is very, very analog. We can make this more smart. Patient knows that he still have 15 minutes before he can see you. You have 5 patients waiting for him, same as the AI system used in the bank. So if you go to any bank, you know how many people are waiting for you before you. So you can easily plan your day. So lack of outcome data is very important. So this app can send to the patient when you choose. So you choose that arthroplasty patient in 5 weeks will receive a score, like if you're doing an Oxford hip score. So even if you want to have a PROMS, which is patient-reported outcome data, you will have it through the app. You have no other way to do this unless you get one of your assistants to call every patient and ask him the 48 questions and giving numbers. That's never can happen. The easy way, on the time you decide, the app will send a notification to the patient, the score will come up, and the patient just take the boxes. And then, using no hand, you'll have all the patient-reported outcomes of your patient at any time. No real-time alert, definitely, and this is a bit of the problem. Very blind decision-making issues because basically your patient goes, I have a patient I've operated on this patient. After 3 months, patient disappeared. Actually, the patient hasn't disappeared. This patient has a problem. You know the way of thinking. This patient has went to another surgeon to take a second opinion. And this other surgeon, if he is honest or dishonest, can easily say, oh, no, that's a very bad job. I have to revise you. And you will never know about the revision because the one who revising your cases is a different surgeon. And this will never come back to you unless you have a way of communicating with the patient, and this is the way of communicating with the patient. When I gave my patient, it's a message, I don't need to call anyone. How are you doing now? What is your score? You will know that this patient has lost the follow-up because he went to another surgeon and had another operation. The global models is everywhere. This is used everywhere in the world. There is now no single surgeon in any big private hospital anywhere in the world which do any noting or documentation. AI collect all the discussion, all the conversation of the patient, everything go to the AI. So we'll not go through a lot through the system. It's basically bridging the gap between the healthcare system and the patient and the end user.
and make this very smart, very easy. So as you can see, in a simple way, it can do all of this for you. AI medical scribe, so real-time consultation, so everything you mention, and it's the SOP is subjective, objective assessment and prioritization. So basically, even if you're speaking like you discussing with the patient and you're nodding or kidding or قلت له نكتة, قلت له أي حاجة, AI model will be able to get this out and keep only the scientific data. So a normal discussion with your patient and everything is done for you. You don't need to do anything. Faster booking system, definitely, because it has an access from the patient to book himself to your clinic. Rather than calling the secretary or coming to the clinic, it can easily through the app book himself to the clinic to see you in the next month. Something like free visita. So you don't need visita anymore, which is taking 30% of the consultation. AI can do that for you for free. 24/7 expert support, because you have automated messages, you have automated replies. So like patient calling, oh, I have some strikes over my dressing. Yes, yeah, you are day 1, day 2 post-operatively, strikes up to 70% is acceptable. Don't worry. This patient will call you 1 a.m. to get you out of bed, and then he say, I have some strikes on my wound. So transparent pricing, so you can see everything on a graph. You know how many you are expending, how many you are earning, how many patients, everything you imagine. And it's definitely HIPAA compliant, which is everything encrypted, and all this data you choose when you want the system to get it off. So I don't think this is a big problem here, but the license in UK, you have to get the identifiable patient data off in 2 years and the non-identifiable patient out in 8 years. So that is for the GDPR compliance. But here, I don't think this is a problem. You can keep your patient data forever. So yeah, that's the core idea. The core idea is to make your clinic smart, easy to do, saving your time, faster documentation, smart templates, image integration, zero duplication, and for the patient, digital onboarding experience, real-time red flags, alerts, guided recovery process, and automated follow-up. For hospitals, definitely it makes a big sense because they can collect all this data from all the surgeons at the same time. Challenges is definitely mindset change, which I think is the main challenge. Staff training and IT system, and this is the data integration. This is exactly the picture of the app which is working now. And you can see all the surgeons or the doctors are there. So one system, one workflow, one patient journey means a smart clinic future. Thank you so much.
Thank you, Mr. Hashim, for the good dose of recent information on AI application. Our next speaker is Dr. Ziad Al-Minawi. He will talk about OrthoXcel revolution from senior-led to a smart educational ecosystem. تفضل.
Hello, good morning, everyone, ladies and gentlemen. It's nice to see you all again. For those who weren't in my first talk, my name is Ziad Al-Minawi. I'm one of the orthopedic registrars working in the UK in the University Hospitals of Dorset. So it's very insightful to see such amazing talks from my colleagues and also from peer colleagues in OrthoXcel, introducing our platform and all the benefits that it offers to current and future surgeons as well. Well, definitely today is nothing any different. We'll be talking mainly about the OrthoXcel platform. What does it offer, the services it provides, and feel free to scan the QR code, which will give you a direct access to the website for you to have a full immersive view as we go along the talk about what kind of services and offers and how artificial intelligence has revolutionized medical education, clinical training, and expertise in practice. So of course, AI has been recently introduced in around 2012, post-COVID times, which has had a significant impact on several fields, not just medicine, also including many different information technology platforms, talking about, for example, different kinds of ways that we can implement medical education, either through a highly immersive environment, which includes talking to a artificial patient and having real live direct responses, and also implementing that in education for your exams in order to have the best of the opportunities for learning and to always have an edge than everyone else in performing in your exams. So an overlook of the platform, of the OrthoXcel platform. As you're scrolling through your phones, you can see several domains where enhanced learning tools are part of the platform, where we have several courses, several webinars, and a lot of teaching modules, and also opportunities to be part of the organization in order to have direct support and peer mentoring and support for any kind of surgeons or being a trainer within the platform. So of course, if you have a passion for medical education, make sure that you jump on board. We definitely want to gather your expertise and any kind of support that you can have in order to have a more of an international cohort from different and several backgrounds in order to give and provide the best opportunities back to the members within the community. So this is the front page of the platform, how it looks like. We do have several courses that we run as well, and educational opportunities. We additionally have a YouTube channel which has all of the recorded webinars that we conduct, ranging from interview training programs, FRCS interview courses, and also several other journal clubs as well, where we talk about a lot of the recent and up-to-date advances in trauma and orthopedic surgery. So as you can see here, we do have additional areas of education, so subspecialty based as well. I believe at current time we do have foot and ankle patient education, which can rather further enhance into different subspecialties as well, FRCS orientation services, and also it includes a comprehensive syllabus which has all of the modules and resources that you can use in order to have the best benefit of using that platform. Expert faculty involved as well, mainly based around the UK, and again, hopefully expanding to international realms as well. Flexible learning, where you can learn at your own time. You can jump into any course and attend the recorded sessions through the different platforms. Additionally, there are WhatsApp groups as well that you can join in order to have up-to-date information about the services we provide. This is what our students say about us. Thankfully, looking at the screen, they're all 5 stars, and hopefully that never changes, and we can maintain that standard of what's provided, of what we provide, and the feedback that we get back in return from people making use of our platform. Additionally, as Mr. Tamer Kamal, the first talk of today's session, talked about the study buddy system, where that gives you a direct face-to-face interactive platform as well in order to help you excel in any kind of educational opportunities within your specialty or subspecialty as well. So where you get tailored learning path about personal development plans, about how can you start with setting out objectives with time frames and reminders where you can directly respond to in order to make sure you're meeting your deadlines, getting personalized feedback from the faculty and the experienced mentors within the community as well in order to maintain your performance and keep your knowledge up to date. And finally, tracking your progress, as mentioned, to make sure that if you're, for example, if you're part of any project or part of any research audit, taking part in a journal club, it sets out reminders for you in order to have an interactive platform and make sure that you're making the most out of this opportunity. And also it helps identify if you have any gaps, for example, during the scripting process or the machine learning process of the learning modules and the data inputted into the platform. It can identify and compare you to other candidates and tell you what kind of areas that you can improve, and having also that privilege of direct feedback from the faculty involved within the community as well. So of course, AI is revolutionizing our orthopedic education, and that's where the future is heading. So jump on board in order to make the most out of it and hopefully excel and follow the current trends of artificial intelligence in medical education. Thank you very much.
Thank you زياد for the presentation. الحقيقة بس كومنت بسيط قبل ما أقدم أحمد. البرزنتيشن الأخير ده فيه كوليكشن لكل اللي بنعمله، وده يعني سيمبل باي باك لأستاذي الدكتور محمد بيه الأشهب، لأنه مهما حضرتك تصورت إنك ترن a lot of online activities في different يعني it's the same specialty but at different levels. It's not an easy job. وعلى مستوى اكبر الجمعيه عشان تران اكتيفيتيز ما بين اونلاين وما بين فيس تو فيس، ويبقى فيها كمان ريسيرش بروجكتس، ويبقى فيها اي اي ستادي بادي. الحاجات دي is no way to be done لما تتعمل تبقى completely digitally transformed. فالبلاتفورم اورثو اكسل دي ده موديول اللي انا بشتغل بيه، وان شاء الله يعني الجمعيه فور فري، لانه هي ميك a lot of easy job بالذات للكانديد. انا لو لسه ببدا حياتي وعايز اعرف في الماستر ايه الكورسات اللي تناسبني، ايه اللي ممكن استخدمه، ايه اللي الدكتور محمد بيه بينظمه في الاونلاين ينفعني ويتعمل امتى وازاي اريجستر له. مساله الريجستريشن على زوم وجيتنج الفيدباك از سو ديفيكولت، وسيرتيفيكيتس الدكتور محمد الله يبارك في عمره يا رب ويجزيه خير، يعني مساله از نوت ان ايزي جوب. making a full platform which can accommodate all of this سواء من نشاطات الجمعيه او من نشاطات الدكتور محمد as an online activities. كل ده ممكن يتحط على بلاتفورم واحده عباره عن ويب اب زي اللي حضرتك شفتوه بالظبط الاورثو اكسل، ويبقى متاح لكل الناس. تنظيم اسهل، وقت اقل. دكتور محمد مع مشغولياته في العماده وكده المساله يعني فعلا يعني قاتله. انا ما عنديش نص المسؤوليات دي، ويعني قبل البلاتفورم I was struggling عشان بس ارد على كل واحد واقول لكل واحد ايه اللي يناسبه وايه اللي ما يناسبوش. طب الكورس ده ينفعني ولا ما ينفعنيش؟ طب هاخد فيه ايه؟ طب مش هاخد فيه ايه؟ طب السيرتيفيكيت؟ طب الفيدباك؟ طب هتعملوه امتى؟ طب اجلتوه ليه؟ طب مين اللي هيبقى موجود؟ كل الديتيلز دي هتبقى موجوده اكتفلي على البلاتفورم. هنسميها ان شاء الله اي او اي بلاتفورم لو ان شاء الله مجلس اداره الجمعيه وافق، ودكتور محمد يعني از كومبليتلي فري للدكتور محمد. هو نفس الموديل بالظبط، هنحوره بس الفرونت بيج بدل ما تبقى اورثو اكسل تبقى اي او اي. اي ثينك هتبقى نقله كبيره قوي للشباب بالذات اللي بيستراجلوا مع ده، ويعني هنريح دكتور محمد بيه شويه ونديله مساحه فور مور اكتيفيتيز اللي اظنكم محتاجينها اكتر. شكرا زياد. و احمد سويلم is a clinical fellow في ساوث هيكلمنا على AI enhanced surgical decision making in orthopedics from pre-op planning to intraoperative guidance and real-time adaptation. Ahmed, please.
Thank you so much for the invitation. So I will start now by introduction quickly about what is AI, which is simple definition. So it's basically simulation of our human intelligence, which is processed by a computer to enable a machine to perform tasks like us. And it's all depending by getting data from learning, reasoning, and problem solving and decision making. So how AI is integrated in orthopedics? So AI is transforming the surgical decision making in orthopedic by enhancing the diagnosis and making precise decision. So recent reviews and studies highlighted the AI cross preoperative planning from image analysis and risk prediction and intraoperative guidance and postoperative monitoring as well. So this is a history of AI. AI actually is not it's not started today. It started a long time ago from induction of CT in the 70s, and then 3D CT reconstruction in the 80s, and then the stereolithographic models, which is 3D printed models, and the virtual surgical planning in the 2000s, and nowadays using the AR and VR based planning. So methods, it was a comprehensive study which we looked mainly between in the PubMed and Scopus and Web of Science up to June 2025, four main domains: preoperative planning, intraoperative AI-guided system, and real-time adaptive feedback and subspecialty application. There was no meta-analysis performed. So I'll start with the imaging analysis and how it used in orthopedics. So it's mainly through 3D reconstruction and 3D bone models, actually, which we get from CTs and MRIs, and this will help us with the planning our operations through measuring the mechanical axis and the anatomical axis and rotational angles, and this will help us with the 3D models we do. This kind of, sorry. This is a kind of an example of how we get fracture, like bone extraction from pelvic bone fracture. So the CT of a pelvic fracture was segmented on the fracture pattern, like the fracture areas. This helped the surgeon to identify and understand clearly how the fracture looked like. And this is another example as well. So the colored pattern shows to the surgeon the areas of fracture, so he can understand, like in a 3D way, how to fix this fracture. The another example is implants selection and AI-driven templating. I think my colleagues mentioned in the morning session. The example mentioned here is about total knee replacement. It was found that using AI models improved the accuracy actually in, for example, 82% in femoral implant sizing, and the tibial component as well, 85%. It as well reduced the correction for the surgeon preoperatively 40%, and this actually reduced the time intraoperatively. This is a kind of picture of an example of how the AI helped preoperatively planning the templating, which identifying the cutting and the measurements preoperatively, which will reduce the intraop timing. Another thing is intraoperative guidance. Usually the AI is integrated with the robotic systems. Systems like the Mako, which is mostly Western system, developed in USA, and the TI robot is an Eastern system, which is developed in China. They provide sub-millimeter precision integrated with AI. So the clinical studies as well reported that there is 30% reduction in operative time, 35% reduction in blood loss, and faster early recovery compared to the conventional techniques. This picture showed like how the future of orthopedics actually with AI and robotics. So from getting a 3D model to a 3D printed anatomic model and virtual surgical planning, and intraoperatively getting a patient-specific implant and using AR-based navigation systems intraoperatively. It's not widely used yet, but there is some centers started using things like patient-specific implants. Another example of the use of AI is real-time adaptive feedback. It's basically to get some it's sensors embedded into the tools we use, like the drills. For example, the acoustic sensing, if you are going through the breakthrough through the bone, so it can detect it within milliseconds, faster than human response, and reducing the cortical perforation risk. Another use is smart implant, which is implanting chips inside our implants. So this will help us understand the load and the biomechanical monitoring post-operatively, and this for sure will let us understand about the risk of failure of the implant. Real-time haptic feedback using the virtual reality and augmented reality as well. This will improve surgical acquisition and reducing the errors intraoperatively as well. AI in spine surgery is mainly about imaging the same and identifying fracture stenosis as well, and assist in the navigation into the operation, in addition to the pedicle screw placement, which shows accuracy up to 97% using AI augmented robotics. This is an image as well, MRI, the AI model on the right side, able to identify the stenosis and the herniated disc. So what is the limitation of AI? It's still not widely used. It's variable data and data quality across centers, limited external validation. There is still model bias and lack of transparency, difficulty integrated in AI system in real world, still into like more of trials, and there is ethical concern around data privacy and accountability. How can you improve it? So the future is to get multi-center databases, data sets, and improve the outcome, get an explainable AI models which will help us interpretation of the outcomes, integration of multimodal data, and combine AI with robotics ecosystem, and real-time continuous monitoring using implantable and wearable sensors. So the conclusion is AI is revolutionizing the orthopedic surgery by enhancing preoperative precision, improving intraoperative accuracy as well, enabling adaptive real-time decision-making. While challenges remain, the trajectory of AI is clear. Actually, it is the future of orthopedics. It will improve our efficiency, personalizing care in orthopedics. Addressing the ethical and validation transparency barriers, I think it will make the AI the future in orthopedics. Thanks so much.
Thank you so much, sir. Finally, I would like to thank all our speakers from the Egyptian speakers from UK, and many thanks for Mr. Hashim for the commitment he showed towards the 77th conference of the Egyptian Orthopaedic Association. And if you allow me, please, I'll speak in Arabic. أنا سعيد جدا بأن الشباب المصري الرائع اللي أنا شايفه موجود في إنجلترا، اللي هو يعني رفع راسنا في إنجلترا. يعني الحمد لله رب العالمين. أنا كنت آخر مرة في إنجلترا كنت في زيارة لجامعة كيل، ورحت حضرت الأسويستري ريسيرش داي، كان من الساعة 8 صباحا ل5 مساء، واللي في الآخر فاز بالكاب اوف ذا داي كان شاب مصري. والله 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 حضراتكم لا تتخيلوا مدى سعادتي وهو بيستلم الكاب اوف ذا داي. يعني زي ما الانجليز قالوا لي احنا احتلناكم زمان بس انتوا بتحتلونا دلوقتي، بس احنا بنحتلهم بالعلم وبالشباب المصري الجميل. اللي انا استفدته في المؤتمر ده بمساعدة اخوة كثيرين منهم اخ فاضل زي الدكتور محمد هاشم، ان احنا ازاي قدرنا نجمع يعني ابنائنا واخواننا الشباب المصريين من الطيور المهاجرة تحت مظلة البيت الكبير بتاعنا، جمعية جراحة العظام المصرية. احنا طبعا نسافر ونتعلم ونشتغل ونثبت وجودنا في اي مكان في العالم، ولكن يظل انتمائنا لهذه الارض الطيبة المباركة، الارض اللي ذكرت في القرآن وذكرت في الانجيل وذكرت في التوراة. هذه الارض المباركة يظل انتمائنا لها. كلمة واحدة بس حنهي بيها الكلام بتاعي. بسم الله الرحمن الرحيم. ادخلوا مصر ان شاء الله امنين. السلام عليكم.